joined by the public advocate, Jumaane Williams, the Manhattan Borough President, Gail Brewer, Council Member Bill Perkins, Joanne Lawson, who's the president of Lakeview, and I thank her for being here. Also, Eliza Bueno, CB12 Chair, Fahim Abdur-Razak, the Schaumburg Plaza TA President, and it's good to have him here. John Lynch from the Frederick Douglass Boulevard Alliance, Ken Stevens from Dykeman Basketball, Josh Clennon and Ticket Mitchell from CB10, Patricia Burns, Lehman Houses, Barry Weinberg, Shatik. Thank you, Bill Perkins, for correcting all of us. I'm doing the best I can, you know. And Barry Weinberg, Barry, where's Barry? Okay. Barry, thank you. Thank you for being here. The COVID-19 pandemic laid bare the systemic inequities that run through our city. Long-term divestments in public health in our communities of color, including the community we're standing in today, left black and brown to die in far greater numbers and face far greater rates of infection. Our minority and women-owned businesses, immigrant-owned businesses, and workers of color bore the brunt of the economic devastation. And as we roll out the vaccine, we cannot afford to repeat the same mistakes. We cannot leave our most vulnerable New Yorkers behind during the most important vaccine of our lifetime. I'm here today with community members that represent the diversity of our city to announce Fair Shot NYC, a vaccine equity plan to ensure that New Yorkers across backgrounds, economic status, occupations, and ages have fair access to vaccines. Fair Shot NYC is a plan to reach every New Yorker where they are, in every culture, every zip code, every language, every income and age group. At the core of Fair Shot NYC is transparency. Time and time again, we have seen the clear, constant communication and information sharing that makes it clear that that's the way out of this crisis. So today we're calling for a number of things. First, we're calling on the city to release all demographic data in real time on who has received vaccination shots to date, with breakdowns by zip code, age, and race. That data is crucial to ensure the vaccine is actually reaching the communities and populations hit hardest by the pandemic. And if it isn't reaching those folks, that data will show the city where it needs to double down. But as everyone here knows, data without cultural and historical context are meaningless. Our nation has a long and dark history of systemic racism and discrimination in public health. No one should be surprised that there is skepticism and mistrust about this rollout, especially among communities that have bore the brunt of so much misinformation and racism. And that is why it is essential that the city work with and within impacted communities to address that mistrust head on. The city should launch targeted public advertising campaigns in partnership with trusted messengers, including faith leaders, workplace leaders, widely known public figures, and influencers. These are people who have deep roots in the communities and can deliver important information within those cultural and historical frameworks. Every New Yorker in every part of our city should know where to receive vaccinations and how to register in advance. Every New Yorker should know how the vaccines are being rolled out, and when different categories of New Yorkers are eligible to register, we should know that too. We have to know about the wait lists, how to make appointments, how to walk in. Every day, the more information we give out, the better all our communities will be. And I'm proud today to be standing with community leaders who are more than ready, willing, and able to get the word out. Our business community also has a vital role to play in making sure that the vaccine distribution is equitable. Alongside our faith institutions and cultural leaders, many employers are in constant communication with their employees. The city should also work with employers whose workforces are high risk and eligible, like home care agencies and supermarket chains, to share information about how and where employees can get vaccinated. Equity means ensuring that workers who want the vaccine also have the workplace flexibility to get it. And that's why the city must require that all businesses provide paid time off all employees who need it to get vaccinated and to recover from any side effects that may follow in the days after the shot. People need to know that they can get the vaccine with time off and time to recover. That is why Fair Shot NYC is so incredibly important. We got to get to the heart of the vaccine rollout issues, and it's about management. Crisis after crisis has shown us when government fails to plan, the most vulnerable among us pay the price. As of this morning, we've only issued 51% of the doses we have. We're not moving fast enough. We're not moving fast enough to keep people safe. And if we don't vaccinate quickly, we do not have a way of reopening our economy. We need better management, especially as supply and distribution ramp up over the coming weeks with President Obama coming into office. I'm calling on the city to establish a supply chain management task force led by the city's health department and the mayor's office of operations that will assign supply chain management workers to track and redistribute vaccine supplies in real time. If one vaccination site is struggling with vaccine delivery or low demand, the task force must be able to allocate and reallocate doses to other sites immediately with no time to waste. The task forces should also work with these low-performing sites to figure out why demand is stagnant and use data to outreach to our communities. In other words, we got to get busy and we got to get more strategic if we're going to save our city and give everybody an opportunity to get vaccinated. And finally, we have an army of city contact tracers working to pinpoint sources of community spread. But look, we're in a second wave, and community spread is not going to stop or slow down until a significant portion of the population is vaccinated. Finding spread is not enough. We need to stop the spread with vaccines. The city must consider reassigning many of the contact tracers to the critical task of promoting vaccine access in all of our neighborhoods. That includes making appointments with special emphasis on the elderly and other high-risk groups who cannot afford any barriers to getting a shot in the arm. Fair Shot NYC is more than a plan. It's a statement of our values. It's a statement to our commitment to equity. New York City was the COVID virus capital of the world, but we can start to turn the page if we can vaccinate our people. Every New Yorker deserves a fair shot, and every family, everybody in this city needs to have real communication in real time. Thank you all for being here. I know it's cold, but I want very much to call up so many of the leaders in the city. And first and foremost, as a leader in this city, is none other than our public advocate, Jumaane Williams.
President Biden, not Obama.
Don't mention it.
Peace and blessings, everyone. I want to thank the comptroller for being here, our board president, our council member, all of the leaders who are here today. We just finished celebrating Dr. King. Dr. King and Coretta Scott King, actually, in particular, talked about the violence that communities feel because of health care inequity. And still, many, many decades later, that still rings very, very true. I first off want to say it is correct that there has been colossal, just magnificent failure on the federal government. From the White House and the president, the lack of leadership is astounding. But I also want to be clear, this is not simply because of that. There have been failures from the executive decisions on the city and state level as well. We have to own them and try to learn from them. But instead, what we see often is a deflection of what has gone wrong and a deflection of responsibility. We have had months, many, many months, to plan this rollout. For us to be failing makes no sense. I want to be clear, we absolutely need additional vaccines, and we all, I'm sure, are going to be on message on that. But even the vaccines that we have not been distributed. So stop only discussing what we need from the federal government and discuss the things that we need to change on the local levels. I toured and was very happy to tour one of the 24/7 sites with the mayor just over a week ago. I'm sorry to say that since that week has passed, As was mentioned, we're still only up to 51%. And I want to be clear as well. There is a lot of blame to go around. The mayor has done some things wrong. But I'm imploring the governor, who has asked for and received unprecedented amount of decision-making power, who even wrote a book on the leadership that he provided, to stop passing the blame. You cannot ask for all of the decision-making and then pass the blame. There has been problems in leadership at every level. There has to be combined health infrastructure and health messaging. The mayor and the governor need to get on the same page, even if you do not agree with everything. The people of the city of New York need to see messaging that is consistent about what is happening in this city. They shouldn't be going to two different press conferences, two different websites, two different numbers. All of us should be on the same page. All of us should be in the rooms having the discussions about what needs to be done. It appears that our executive leaders are making these decisions by themselves without us in the room when those decisions are made, and then we have to come at the back end to try to fix it. I have stood and will continue to stand with people who are proposing ideas. I have proposed my own ideas. We are pleading with you. We have to get on one page and one accord. So while we need more vaccinations, at least the vaccines that we have can get out there. We know how to do this. We just did a wonderful job on the census count. In the middle of a pandemic, I'm proud of what we did. The networks exist to get information to the folks who need it the most. The biggest part I want to push here, just this morning, my office put out a letter in the vein of the comptroller asking for real-time data on the demographics on who's getting the vaccines. It is very important because the people who need it the most, almost all of the focus of who is summoned is in black and brown community. I am afraid, but I'm concerned that very likely we may not see what we want to see. There has to be equity in who gets vaccinated. So we want to see all of the data, demographics is who's getting it. That's important for transparency, but it's also important for planning. If you can see in real time where the vaccines are going, you can adjust in real time. Mr. Mayor, Mr. Governor, no one is expecting a perfect plan, but everyone is expecting consistent messaging and the best plan for it. That has not happened so far. You have a wealth of information from these electeds and from these leaders. Bring us into the room before you make these decisions so we can help. We have our feet on the ground to get this information out. It's not enough to have vaccines if they're not going into people's arms. Thank you.
Thank you, Public Advocate Jamani Williams. And thank you very much. And now to hear from the President of the Borough of Manhattan, Gail Brewer.
Thank you very much, Mr. Controller, Public Advocate, Council Member, and these amazing local leaders. I just want to indicate that about a week ago, because I have received so many calls from Manhattanites who are looking for a vaccine and can't get one, we sent a letter to the mayor with some of the issues that you heard about, and we made some suggestions. Number one, who is the vaccine czar? When we had a food problem, we had Catherine Garcia come in, and to be honest with you, she did a great job. Who is the vaccine czar? There are so many different agencies involved, it is hard to know who to call. Number two, all of the technology issues. You should know that there is a health and hospital site. There's a Department of Health site. There's a Columbia Presbyterian site. There's a New York State site. There's a Northwell site. And the CDC has their own list of vaccines and buildings that they're working in. And then there are probably other sites that I don't even know. The point is, the city of New York should have one site and should have relied on the technologists that are in its portfolio, people who know and do it, people who know how to put this together. Instead, the health department and the health and hospitals decided to do them themselves. 2 sites makes no sense. The whole issue of technology is a challenge. When I book an airline, you call one, you then find out that you can't go on a Tuesday, but they have a Saturday flight. That's the kind of information that should be available. One woman called up and she said, in the past, if I want a mammogram, they tell me on February 22nd I can get it. It's not that I don't get an appointment. I also want to mention locations. You heard here today about some of the challenges. Let me be specific. In the last couple of days, I've been to NYCHA developments run by the state, run by the city, no coordination. Everybody is trying, but they're pop-ups. They're term limited. We should be working with the specific health centers in the neighborhoods. Those centers are on somebody's site. You have to call the center, and they're always told no appointments. When we were at Corsi, which is a development in East Harlem for seniors, not a lot of transparency, but there are 106 residents in the apartments. 100 doses were used, which is good, but we don't know if they were from Corsi or from other developments or just people coming off the street. When I was at Polo Grounds, again, not a lot of information to plan. We were knocking on doors to get people to come down to get their shots. People came from 3 different developments in the area, which is good. It was run by the police department, which was a little strange. And we heard at one point there were 1,000 doses, and then I heard from somebody else there were 600 doses. Transparency, we don't know if they were all used, some used. It was a 2-day project. You'll hear from Community Board 9 because there is no center for vaccination in their area. And Roosevelt Island, which had no testing until we helped them get testing, now has no vaccinations. I do want to thank Columbia Presbyterian because they opened up the 168th Street Armory. I was there for the opening. But it focuses understandably on their patients and Washington Heights residents, and they are reaching out to the senior centers. But if you go on the site, it simply says no appointments, no appointments, no appointments. Very hard for people trying to get an appointment. We also mentioned the issue of special populations. What's the transparency in homeless shelters, jails, group homes, drug treatment centers? Are the nursing homes really completed, done? Do we have a piece of paper and information to that effect? We read in the paper, as you heard earlier, the low percentage of vaccinated in New York City compared to other places in the state where it's 81%. Question number 1. Question number 2, why is there no coordination with the state? Whenever I'm at a state facility, vaccination, as I was the other day, in a wonderful church in the basement, couple days of pop-ups, but there's no coordination. I also went to a state NYCHA vaccination site, excellent, no coordination with the city. This pop-up is new, but vaccination is a life and death matter. It's different than testing. I don't know if this is the way to advocate for good public health. Is it being done just in communities of colors, or is it across the city? We should plan that we have 50,000 doses or 400,000 doses. What's the plan? It should be transparent. Do we use all the vaccinations?
That's correct.
Give more time to people to tell them about the locations of vaccinations. Abyssinian Church was great. I can't tell you how many calls I got because I was in the press about it. Why didn't you tell me, Gail? Well, I didn't know about it till I was there. It was booked by the time I knew that that site existed. That's not how to do. You have to have a central booking site, just like you do with an airline, a hotel, and then people are sent where there is the vaccination. People will go. I do want to thank the mayor for providing transportation for the seniors, but I don't know where they're going to go because you can't get an appointment. Pop-ups on the weekend? Are we going to have some information? Of course, are we going to have vaccinations is another question. So, because of all these different challenges, In Manhattan, we have organized a Manhattan Task Force on vaccinations. We have a meeting date coming up next week, and we will try to at least do what we can to make some sense of all of this. Thank you very much.
Thank you very much. Next up, we have the Lakeview TA President, Joanne Lawson. Joanne. There you are. Thank you for coming.
Oh, thank you. I'm out here asking for the help that we need. We as a community, and I'm advocating for Lakeview, but more so the community. We haven't been able to even get vaccines nor testing. I have a 446 apartment community. We have over 50% of them are seniors that are not able to go do the technology and all of that. They need the vaccine to come to our community within an accessible area of our community, which is something that we don't have at the present. I have plenty of other TA presidents that we all work together to try to get the same thing coordinated. We haven't been able to do that. We need the assistance of everyone to help us get vaccines into our community and testing sites that are easily accessible. And I appreciate your time.
Thank you so much for being here. Thank you. Next up, Eleazar Bueno, the CB12 chair and a small business owner. Please come up.
Thank you. Thank you very much. Thanks to the office of the Stringers, Controller Stringers, and the office of Gail Brewer. I'd like to just say a few things. One of them, there's an African saying, probably Nigerian, that says that when two elephants fight, the village suffers. We are suffering because the elephants are fighting. I think that I'm going to piggyback off of Jumane's comments that our leadership needs to put it together and be on the same page. The people in those morgues sound and look like me or people like Kenny. We are suffering. All we need is for our leadership to call the fire department, which is the vaccination unit, and go to where there's fire, which is where most of the people that look like me and sound like me contributed the bigger amount of deaths. We're advocating for unity, and we're advocating for the vaccination to come where people died the most. Thank you for the opportunity to speak.
Thank you very much. Thank you. Thank you. Thank you to all the speakers. Any questions from the press? I know you're all cold.
Okay. Is there a single source for the data you want, or is it like everything else we just roll out, different organizations, different places, and that will make a bigger challenge to actually get a picture of what's going on?
Look, there's definitely, and the point's been made, there's state data, there's city data, but look, today Fair Shot NYC is about getting City Hall to create a unified website that would allow us to see in real time all the data points. As we said, we want to see demographic data. We want to see geographic data. We want to see how many shots are getting into people's arms, and we need to find one unified website. As we pointed out last week in a series of press conferences, when you have 3 different websites to get online simply to make an appointment, that's troubling. Now, why is it troubling? Because the people who are trying to go online were not the 75-year-olds trying to get online. It was the children who were trying to help their parents and grandparents, and none of these websites worked. They crashed in the middle. But now, if we're going to make smart strategic decisions about the vaccine, Fair Shot NYC is about putting it all together. And that's why we're standing here with elected officials. That's why we're standing here with community leaders. Enough is enough. I can tell you as controller, we are not going to reopen the city economy unless we vaccinate. And every day we wait, not only do we jeopardize lives, but we also stall the economic recovery of the city.
Can I say one thing on that? Sorry. I just want to be clear, because this question is important. And it'll be good to see what comes back. We should assume that they even have that data, that it's easy to put out. But it can come back that they haven't even been collecting it in the way that we want. And that's something that's important.
Very good point. Very good point.
Demographic data that you want, is that currently being asked of people when they sign up to get a vaccine, or would people need to be asked additional questions for that?
Yes. As far as we know, they have the data. It's being collected, but no one will share it with us. Absolutely. Where you live, how old you are, all the pertinent information so that we can make smart decisions. Look, we made the point today as part of our proposals about how we better utilize contact tracers. What we really want are for community leaders to be able to be told where people are not willing maybe to be vaccinated because they have real concerns. We also want to make sure that hospitals have a real-time understanding of who's running low on doses, who has excess supply. All of this has to be coordinated and managed, and that's what we're trying to get.
Adam said over the weekend.
I don't know what he said over the weekend, but I can follow a lot of what he says, so yeah. Anybody else? I don't know. Be warm. Thank you.